we are discussing about stress during COVID-19 are the large family of virus that known the cause illness ranging from the common cold to more several diseases such as middle is respiratory syndromes and several acute respiratory syndromes. The novel coronavirus was identified in 2019 in Wuhan, China. This is new coronavirus that has not been previously identified in human. This cause provide a general introduction to the COVID-19 and emergency respiratory viruses and intended from the public health professionals in incident managers and personal workers for United Nations, international organizations and NGOs. As the official disease name was established after material creations, any mentions of COVID-19. The infections disease caused by most recently disorder coronavirus. By WHO is the large the current outbreak of pneumonia that began at the beginning of December 2019 near in Wuhan city. Very little clinical knowledge of COVID-19 disease is currently accessible and the details of the age span, the animal organ of the virus, incubation time, outbreak cover, dissemination, pathogenesis, any clinical responses. Antivirals are lacking among of the serious cases. Now my friends will give you a further information about COVID-19 in pandemic condition.
Follow the part of COVID appropriate behavior. Breathe without physical contact. Maintain physical distance. Wear reusable hands made face cover or mask at all times. Avoid touching eyes, nose and mouth. Maintain respiratory hygiene. Wash hands frequently and thoroughly, regularly. Clean and disinfect frequently. Touches surfaces. 8. Do not spit in the open. Avoid unnecessary travel. Do not discriminate against anyone. Discourage encourage safety. Do not circulate social media posts which carry unverified or negative information. Seek information on COVID-19 for credible sources. 14. Call national toll-free helpline 1075 or state helpline number for any queries. Seek psychosocial support for any stress or anxieties.
I myself, Harshali Kokare, I am telling with stress during COVID-19. During these difficult times, we are all expressing stress in some form. These stress affect people in different way. Take a moment to notice affect your feeling. These are normal reaction to an abnormal situation. It is important to take time to care for our mental health during COVID-19 and other period of heightened stress. Avoid coping strategies that will make you feel worse and instead use strategies like taking about experience, spending time with loved ones, getting your new from reliable source and taking care of yourself, physical, mental and spiritually. Remember, you are not alone. If there is violence in your home or if you are thinking of hurting yourself or other talk to a trusted friend, family member or concern or call your local emergency hotlines. There is help in your community. Stress management during coronavirus has disturbed our normal life, causing a lot of stress for people around this world. Here are tips to help you manage and reduce stress during these difficult times. Exercise regularly, have fun, spend time out home, sleep well, relax and do something you enjoy. Spend time with friends. Don't focus on things said or not in your control. Meditate, learn something new.
Hello everyone, this is Sagar Bavdhane. Today I am going to tell you about Corona Warriors. While on one hand, people across India and around the world are largely confident to their homes with businesses and education institutions all shut down in an attempt to contain the virus. And on the other hand, doctors, healthcare, other workers and medical staff members and leading to the battle against COVID-19 from the front, putting their own lives of risk with selfless determination for the sake of saving lives. They are truly are our heroes. In this challenging time, while they are putting their own health, families, and most importantly, their own lives at risk. Since the coronavirus outbreak, healthcare professionals have not only experienced the gratification of healing patients and saving their lives, but have also lost many battles along the way. On top of that, many doctors have even sacrificed their own lives in their line of duty. Every day, the selfless warriors are giving it their all in healthcare setting while cutting themselves off from their families and loved ones. The sacrifice that they are making for the safety and welfare of humanity is priceless and deserve lifelong gratitude on our end. Most importantly, we must realize the value of healthcare workers over in our lives and the kind of treatment they get from us.
Symptoms of COVID-19 are variable depending on the types of variant contracted, ranging from mild symptoms to critical and possibly fatal illnesses. Common symptoms include cough, fever, loss of smell and taste, with less common ones including head chest, nasal congestion, runny nose, muscle pain, sore throat, diarrhea, eye irritation. Moderate to severe causes breathing difficulties. People with COVID-19 infection may have different symptoms and their symptoms may changes over time. Multi-year studies are underway to further investigate the potential long-term effects of disease. The Omicron variant become dominant in the US starting in December 2021. Causes COVID-19 is caused by infection with a strain coronavirus known survive active respiratory coronavirus. Thank you.
Hello, my name is Sakshi Shelar. Discuss the topic online school and online work. The COVID-19 pandemic led to the numerous government deciding to the close school of several weeks is the spring to 2020. Empirical evidence of the impact of COVID-19 related school courses on academic achievement is only just emerging. The present work aimed to provide a first symptomatic overview of the evidence-based study on journal and a differential effect of COVID-19 related school courses as spring 2020 on student achievement in primary and secondary education. Result indicate a negative effect of school courses on student achievement, specified in the younger student and younger from families and low economics studies. Moreover, certain measure can be identified that might mitigate this negative effect. The finding the discuss are the context of their possible consciousness for national educational policies, the long vacuum of school courses. uh, Coronavirus outbreak, Medicaid pandemic impact most of the sector globally. These include the academic world that consists of the million enrolled learners and active teachers who previously had regular classes in the institution and due to the pandemic got stuck at the home to continue the education process. The online class in the introduced is most the countries including India. In the online class was including India in the mode Both teaching and learning happen through the electronic devices, which are relatively new to the inter-teaching learning community. This study aimed to understand to discuss the treatment of COVID-19. Asymptomatic cases, mild cases of COVID-19. Isolate yourself in the ventilated room. Use the triple layer medical mask. Discard mask after 8 hours of use of the layer if they becomes weight of the visibly solid. In the event of the caregiver entering the room, both caregiver and patient may consider using N95 mask. May consider using N95 mask. Monitor oxygen saturation with the pulse oximeter daily. Monitoring temperature daily. Give the vaccine, Covishield and Covaxin. Thank you.